Hello, this is Dr. Scott Harrington coming to you live from my virtual doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor virtually from most US states. Not just for a one-time consultation, but as your primary care doctor, someone who gets to know you, someone who can be your health advocate. Because I'm licensed in most US states, even if you move, you don't have to change doctors. If you are vegan, then get a doctor who gets you. If you haven't yet adopted a plant-based diet, you are still welcome to be my patient. But beware, diet and exercise and lifestyle changes will always be my first recommendation. My goal is for you to take control of your health, and through the power of a healthy lifestyle, we will work to heal your chronic conditions and help you get off chronic medications. Before we start today, we have an announcement. Thank you for everyone who came out to the Solid Rockin' Veg Fest outdoor event and saw my talk and spoke with my wife and I at our booth. You may have heard our announcement starting in the month of May 2021. We're going to add in-person visits due to an increased demand to be seen in person. The office is located in Pinellas Park, centrally located between Clearwater and St. Petersburg. We will be co-located with the outstanding pulmonologist, Dr. Michelle Zatuni. She's a classmate of mine from the Philadelphia College of Osteopathic Medicine and is graciously giving us the space we need to see patients in person. With in-person visits, you can be seen for work or school physicals or any other specific in-person exam that you need, but we'll still be offering lots of telemedicine availability, so you'll have that too. Remember that this content is for educational and entertainment purposes only. This video is not intended to take place of your own doctor's advice. Okay, we're live streaming on multiple platforms, ready to take your questions. Okay, we have several people watching. So go ahead and post your questions in the comment section. We'll highlight the question and get it answered for you. If we can't answer it, or if it's more specific, you want to send me a direct message in Facebook. That's another way to ask questions. One of the things that, once again, thank you, Dr. Michelle Zatuni, if you're watching. Thank you. That is a great opportunity for me to see my folks in person. Some people just like to have that in-person, to be able to see someone in person, and to certain exams, it's required to have an in-person visit. Some people don't want to have to pay for like this Taito Care device thing, so that you can do this remotely with the heart exam and the lung exam. But so that's going to be an option available. One of the things that came up, one of the questions was at the conference was, what is it about the vegan diet that really caught your eye? What was easy about it? What do you like about it? And I not only does it make me feel good, not only does it cure your medical problems, most of them, I got to admit, it's liberating. When I went on a vegan diet, generally I would think about dinner time as chicken, steak, or pork. I kind of, in a way, it's actually kind of a limited palate, a limited menu. But when you switch to a plant-based diet, it's corn, potatoes, pasta, and then all these different vegetable varieties that you're looking into. Before, I never focused on the side vegetables very much. Peas and carrots or something. But when I went on the plant-based diet, vegan diet, it opened up lots of different things. It's really fun. It's really fun to try out new recipes. It opened up a whole new world of food, and it's really enjoyable. So people think about it sometimes as restrictive, but it's actually not restrictive. When you start it and you make those rules for yourself, it really opens up a freedom, a sense of, wow, I can eat all these things and I don't have to be writing down my calories. I don't have to be worried that everything I put in my mouth is going to make me gain weight. Or be bad for my diabetes and that sort of thing. So that was, people think it's limiting, but it's actually not limiting. It actually opens up a whole wide variety of possibilities. Okay. All right, so we've got a question here. Eric Appleseed. There are so many conflicting books on anti-inflammatory diet and autoimmune disease. Which ones do you recommend? Great question, Erica. I recommend any of the vegan royalty folks, like Dr. Barnard, Dr. McDougall, Dr. Dr. Greger. Dr. Greger's got an amazing reference book, practically, How Not to Die. Uh-oh. Here we go, How Not to Die. He goes over 15 major killers in the Western world, U.S. and other Western countries. He talks about how the plant-based diet is helpful for these. So I know there's been books written on autoimmune specifically. Dr. Furman wrote one called Super Immunity a little while back. It's a great book. Basically, when you go on a plant-based diet, it dramatically improves a lot of autoimmune diseases, joint pain, psoriasis, psoriatic arthritis. There's, you hear stories about lupus and everything. The problem is that there's not a lot of controlled studies with the plant-based diet as the treatment arm versus a placebo for these autoimmune. But anecdotally, you hear lots of stories, and in my own patients, they talk about dramatic improvements. So short answer is, I would start maybe with Dr. Furman's Super Immunity, and then branch out to those other books if you need. Okay, let's see. We have Lindsay Wilson. Have you discussed FODMAPs before? Pretty intense stomach issues now daily, and have adopted a GI. Had you having a GI appointment scheduled, thought I'd eliminate FODMAPs while waiting on my appointment. Okay, the FODMAP diet was a diet that was designed for irritable bowel syndrome and to decrease gas-producing elements of your diet. And so, I don't have irritable bowel syndrome, and so I can't speak to this in terms of experience from the illness sake. But the short answer on this one is, you can try it if you'd like, if you're having problems. If you're already on a whole food plant-based diet and you're already, you've maxed this out, you're on a whole food plant-based diet without oil, no salt, oil, added salts, oils, and sugars. I mean, you're so clean. If you're already there and you're still having awful irritable bowel gas, pain, then definitely focus on the FODMAP diet. But if you're not very clean with your diet, I would recommend that first. One of the problems that when people get into these elimination diets is that we tend to, as humans, we tend to get in the habit of eating the same things kind of over and over again. Maybe 4 or 5 things, you switch it up, but you end up eating the same things. When you start taking all these things away from your diet with the FODMAP diet or other things, like a pregnancy diet or you're breastfeeding, they say don't eat certain things, you start to eliminate so much that it really, you start eating a very constricted diet. And I worry about that. In terms of the goal is to eat a variety of foods. Now, one way to attempt it, if you're having a lot of gas, is to do an elimination diet and use the FODMAP as guidance. But overall, I say clean up the diet first with a plant-based diet. If you're still having problems, then switch to the FODMAP diet. Okay. Natalie Seaside, I feel so much better now that I've started my vegan diet. My skin looks so much better. All right. Thank you, Natalie Seaside. Yes. So tell us in the comments how soon it took for you to see benefit from the plant-based diet in terms of your skin. I've heard that most people, when they started, may take about 4, 5, 6 weeks to start having those anti-inflammatory effects clear up their skin. And the lesions that are already there sort of heal. Maybe takes about 6 weeks. And you can get dramatic improvement with acne. Okay, so we've got Kristen Backer Ali. Hello, Kristen. It's so good now having the option of a vegan doctor. Thank you, Dr. Harrington. Thank you. Thank you, Kristen. Kristen works with Dharma dog treats, and we saw her at the Veg Fest, and we've got some of her awesome dog treats. Our dog Banjo is loving them. Thank you so much, Kristen. Thank you. Okay. While we're waiting for a question, I've had some folks over the last couple weeks who have been worried about their blood pressure. They've been worried about their blood pressure, but they're also highly into protein and working out. And they are under this old assumption that you have to have high protein so that you can really, gain muscle. And I want to dispel this myth about protein equals muscle. If you think about it, we're trying to make our muscles bigger by eating animals' muscles. And so you don't need to think about it like that. I mean, how does a gorilla get so big? How does an elephant get so big? Just eating plants. And so one of the problems is when you're consuming a lot of protein, the kidney has to deal with all this protein. It has to work harder. And you can actually damage your kidneys eating a high protein diet. I mean, even the FDA has mentioned that United States men tend to eat double or not, if not more than the amount of protein that's required. And so even the FDA, which really doesn't mention too much about that stuff, has even mentioned it. Is kind of ridiculous. So I'm impressed with that. So you don't need to eat extra protein to gain muscle. Now you need to eat enough calories to match your calories that you're losing through exercise. And you have to have resistance exercise. That's the only way you're going to really gain muscle. One thing you'll find when you switch to a plant-based diet, you tend to lose weight down to about your 18-year-old weight, and your fat body percent goes down. And you start to be able to see the muscles that you have. And so you actually start to look like you're a bodybuilder, even though it's mainly through diet. So 1 second. So that's another added benefit of the plant-based diet. All right. Okay. So Kristen has highlighted it's dharmadogcompany.com. So check it out. Okay. James Hannum. I have less gas when I eat a vegan diet. That likely come from less dairy and fried food. That is a good point. All right. Thanks, James. James points out about gas and the plant-based diet. Now, I will say that the intestines, the microbiome, it is a constantly changing environment in terms of the microbiome and the amount of plant-based eating bacteria and the putrefying type meat digesting bacteria. And this balance depends on percentages of carbs and plant-based foods that you're intaking versus meat-based foods that you're taking in. And your body adapts to try to best meet the requirements for the food coming in and digesting it up most efficiently, just from an evolutionary perspective, a systems engineering perspective. The stuff that you feed it is what grows. And so when you switch your diet quickly, you can have a mismatch. You can be eating food that your body's not used to dealing with, and you develop gas. And this can usually last for 3 or 4 days until the microbiome adapts to what you're eating. So this is another thing. This goes back to the question that was brought up earlier about FODMAP and gas and feelings of fullness and pressure. Is that it may take a couple of days for some of these things to even out. You may want to limit the amount of if you never eat beans. You may start with a 1/4 cup, and then the next day you have a 1/4 cup twice a day, and then 1/4 cup 3 times a day. I've experienced this one time where I ate a huge kale salad that was way more kale than I was used to eating, and I had sort of gas, kind of not pains, but kind of a little bit uncomfortable. And so, yeah, it can happen. It can happen. But the goal is to be eating this way every day, and then it becomes a standard operating procedure for your body. Okay, Lynn Bobcom. My sister has recently had a bout with diverticulitis. She's not on a plant-based diet, but is moving in that direction. What foods do you recommend if she feels about coming on? I can't wait until she is whole food plant-based. All right, Lynn, great question. When people have diverticulitis, their bowels are inflamed, and you can put them on an inflammatory type diet, an inflammatory bowel diet. And so this is, you start with liquids like juices, fruit and veggie juices, or vegetable broths. There's no fiber. And then once they're tolerating that and the pain is starting to go down, you can start to go into like a smoothie type situation, a little bit watered down smoothies. You can go from vegetable broth, you can transition to like a squash soup. This is what we recommend with folks that have inflammatory bowel disease like ulcerative colitis. Once they get off the liquids, you can switch to a soup that is a squash and potato soup, whether sweet potatoes or regular white potatoes. And you use an immersion blender and you blend it down, and the consistency is kind of like baby food or a little thinner. And I know that sounds gross, but it allows them to get some sustenance, and it allows them to not have such a fibrous bulk initially. And then you switch from there into the more plant-based, more whole foods. Just have them chew it really well. And this may take 4 or 5 days as a transition. Okay. All right, Lynn, thanks for the question. Okay, Sandra Harrington, I do have to admit we are having a visit from my mom. Hi, Mom. Sandra Harrington, how are you doing? Miss you. My mom asked, will arthritis be improved with a vegan diet? And the answer is absolutely. When we, initially in medical school, we learn about rheumatoid arthritis as inflammatory and osteoarthritis as wear and tear, as the expected situation that's going to happen over the years. But we're learning more and more that even osteoarthritis is inflammatory in many ways. And an anti-inflammatory diet helps. And people will experience this. And I think my mom might be sort of laying this seed question for me, because I've heard her talk about that when she switches to a more whole food plant-based diet, she starts to have less feelings of pain in her joints, less morning stiffness, and this sort of thing. Love you, Mom. Thanks for the question. Okay. All right. One other thing that I like about the plant-based diet, and this one is kind of funny and it's kind of annoying, but I think it's easier to clean up after a plant-based diet, a vegan diet. Imagine that you're having a big meal, like a big meat meal, or you're cooking bacon and there's all this grease that comes out from your food, and you're soaking the pots and you're putting the soap in the hot water trying to clean up, and the whole house kind of has the smell of the cooked bacon fat and stuff like this. This kind of thing is annoying to clean up after, and think about what it's doing on your insides. When you cook with low oil or no oil, you just simply kind of wipe the pan, rinse it. Yeah, you could use soap, but it cleans itself. You rinse it off, boom, boom. It's weird the amount of benefits that you found. And I've even found that the cleanup from a plant-based low oil meal is super easy. Okay. All right. Pam Hontham, what can I do to reduce excess inflammation? Thank you, Mom, for reading my mind. All right. Okay, Pam. All right. So, the whole food plant-based diet is an anti-inflammatory diet. So there's not, the good news about this is that there's not a diet that reduces coronary artery disease and a different diet that you use for joint inflammation and a different diet that you use for bowel inflammation. The good news is that a whole food plant-based diet will cover all these, and it is an anti-inflammatory diet. If you are looking to add sort of supplementation to this, I'm not talking about, the pills that you buy at GNC. I'm talking about things like flax seeds, ground flax seeds, the lignans, and the omega-3s. These can add plant sterols. Plant sterols are things you can get in a supplement type form. You can get them online at Amazon. These things will help to bind with the foods and help you to reduce cholesterol. When you go on a plant-based diet, you're not intaking cholesterol. Cholesterol comes from animals. The animal cell walls, that's where cholesterol is stored in the body, and so by consuming it, you're intaking cholesterol. But when you go on a plant-based diet, not only are you reducing cholesterol, you're reducing the intake of oxidized cholesterol. Oxidized cholesterol are the animal products. When they're heated up, the cholesterol gets oxidized and it's more damaging to your body. So especially foods that have been heated up multiple times or put in the microwave in terms of oxidation. So thawed meats and that are reheated tend to have more oxidized cholesterol. We're learning that is even more damaging to the cholesterol than normal cholesterol that you intake. Okay. Here we have a question from Kathleen Roush Ford. Hi, how are you doing, Kathleen? What do you think about the fake meat products that are on the market? Okay, great question. Great question. So, short answer is I think they're great for transition, but they're rich and you should treat them as rich foods and not eat them every day. If you're eating hamburgers every day and you switch to plant-based burgers, that's going to be a healthier alternative. But in the end, a lot of the fake foods have a pretty comparable amount of fat and tend to be kind of higher in protein and need to be considered rich foods like a delicacy that you don't eat very often, or you just eat at a party or on the weekends or something like that when you're kind of letting loose a little bit. But by all means, if you need these foods to help you transition away from the meat and cheese is a result of slaughtering an animal, and ethically we want to get away from that. We want to get away from the ecological impact of animal factory farming of animals. And so not only is it good for your health to switch, but it's also good for the environment and it's good ethically, and you're not participating in harming animals when you do that. So for so many reasons you want to switch, but in general, treat these foods as delicacies, as rich foods that you don't eat every day. One exception I think is reasonable is a plant-based milk, like almond milk or oat milk or soy milk. I know that most people will eat maybe some cereal for breakfast, or they'll be doing some baking or something. This is a great alternative to dairy because it's so much lower in fat, and of course it's not participating in the dairy factory farming. Thank you, Kathleen. Okay, Kristen Backer Ali. Is there any validity to the blood type diet, even if it's done plant-based? Okay, good question, Kristen. Some of the folks at PCRM with Dr. Barnard have reviewed the blood type diet. They even did a study where they took people in the different blood types and reviewed outcomes from a plant-based diet. And the answer was everybody got better on a plant-based diet, whether you were blood type A or blood type B or blood type O. So the assumption was that the blood type diet was a myth, but we had it studied and we proved Physicians Committee of Responsible Medicine with Dr. Barnard, they proved it beyond a shadow of a doubt. The blood type diet has no place in terms of weight loss and health. However, one of the things that they have found, there are differences in blood types and blood and different outcomes, and certain illnesses are more associated Like for instance, during the COVID pandemic, we have found that O blood types tend to have less severe outcomes in general as a population than the other blood types. But in general, you don't have to think about your blood type in terms of your relationship with health, because just because, let's say you're an O blood type, you're still going to want to wear a mask and you're still going to want to, social distance and do all that stuff. Okay, thank you. Thank you, Kristen. Okay, at this time, anybody watching right now, go ahead and smash the like. Whether you're on YouTube, whether you're on Facebook, go ahead and smash those likes if you're liking what you're hearing. And thank you for all the support. Subscribe if you're on YouTube, and like the Facebook page. Vegan Primary Care. I really appreciate the support. Everyone's been so great for coming on and getting involved. Okay. We've got Alaska Xavier. We would love to connect about Vegan Primary Care. 1,000 members, 100 or 1,000 members. We would love to connect too. We will get with you, Alaska Xavier. Thank you. Okay, we've got some props from Wes Hucker. Thank you so much. This will combat a worldwide pandemic of misinformation. Okay, thank you. Thank you, Wes. Okay, Alaska Xavier is talking about how he is a holistic coach and he can help cleanse and detoxify. That is good. He is doing indigenous medicine. Very impressive.
Tell them about we just got a contract.
Okay. Vegan Primary Care's Communication Director, Jennifer Harrington, has announced that we have recently obtained contracts with TRICARE Prime. Now, we are currently on TRICARE Select, where it's a PPO where people can select their different providers. But now we have got on TRICARE Prime. So military members, active duty members, and their family can see me as their primary care doctor. And that's all through the East Coast and in states that I'm licensed in. And so we'll be looking for more licensings in different states as well. But that's really good news. That's really good news. Thank you, Jennifer. All right. Fernanda Thompson, do statins prevent heart attacks? Okay, statins are highly studied, and yes, they are. People who've had a heart attack in the past, the rates of heart attacks in the future are lower on statins. The mortality data is questionable with the statins, but they have been well studied multiple times in thousands of people, and so. I tell my vegan patients that if they can't get their cholesterol down into an acceptable range, at least under 130 LDL, that it is a reasonable option to go on statins. For folks who are interested in avoiding statins, I have people take supplemental sterols, which have an effect at the intestinal border where they will compete for cholesterol absorption. And once they get into your system, they also have an effect to overall reduce cholesterol. So that's one of the things that I offer or I recommend to my patient: plant sterols and the portfolio diet, including beans and grains in the diet to help decrease the cholesterol. But I am not an anti-medicine person. I mean, I am an osteopathic doctor where I try to decrease the amount of medicine required, but I recommend evidence-based medicine. And where the evidence is there, and where the medication has a low harm and low and has good efficacy, I do recommend these, and I can prescribe them through the service. Okay, I think we are about at time, so I want to go ahead and say thank you so much for your coming today. Thank you for participating. With me, Dr. Scott Harrington, and Vegan Primary Care. I look forward to doing a weekly broadcast to answer your questions. Once again, thank you for your questions. I look forward to seeing you. Now, I will say that there is going to be a pause for 3 weeks. There will be some, going to be working with the military for the next 3 weeks. so I will not be on this live version, but look out for me after that time frame, and I'll be there. And you can always reach out to us on Facebook, direct message, or at veganprimarycare.com. I look forward to working with you, and thank you very much.